Well, welcome everybody. I'm so glad that you're here for this exciting webinar presentation to learn more about health and lifestyle coaching and the program OPTAvia. OPTAvia stands for the Optimal Way of Living, and it's a health and lifestyle coaching program that's physician-led, and it's helping people to create optimal days. That's what the logo stands for. The 24 radiants inside of that circle stand for the hours of the day. And what we're about to share with you is a physician-led program that is actually clinically proven, scientifically formulated to create predictable transformation. And I'm so glad that you're here today to get a chance to learn from some of the health professionals that are using this program inside and outside of their practice. And we're going to be getting to those interviews in just a moment. My name is David Bush, and I'm not a licensed health professional. I am a certified OPTAvia coach, and I have been coaching for over 10 years. I've personally coached about 1,000 clients and individual coaches personally, and I've also developed a team of over 450 health coaches all throughout the country. And they come from different walks of life. Some are physical therapists, some are physicians, maybe specialty in internal medicine or rheumatology or family practice. We also have chiropractors, nurse practitioners, and you're going to get a chance to hear from some of the people that I get the pleasure to partner with. And if you would have told me 10 years ago that I would be leading a revolution on health and lifestyle coaching, I would have thought that you were awfully funny, because that was one of my greatest weaknesses. I graduated high school as a 327-pound overweight football player, but because I played football, I got away with it for a lot of years. And I went on to play a thing called arena football after playing collegiately, and I then got into regular sedentary life, and I ended up losing some of those motivational factors that kept me in the game to do the things that I didn't necessarily want to do, which was exercise and be active. And I started focusing on the wrong things, and that put me into a very unhealthy position personally and professionally. You see, I was working as a business coach. I was working with a lot of entrepreneurs, and I was coaching them to achieve their goals and dreams. And at the very same time, I was failing at achieving my goal and dream, which was to get to a healthy weight and learn how to live a healthy lifestyle. But it was with this program called OPTAvia and with the comprehensive lifestyle program that I ended up losing 100 pounds. Those results may not be something that you have experienced, but it's my personal story. And it's something that I was very proud of accomplishing. And I never had any interest in actually coaching people on their health. But when I was introduced to the opportunity to start helping other people to get healthier, I began to think how it would help me personally. And so I decided to go through our certification coach training. And now I've had a chance to partner with so many different health professionals on this amazing health and lifestyle program to begin to fight the battle and to win the war against obesity. Many of you are already aware, this isn't new information to you, but we are losing the battle when it comes to the epidemic, the global pandemic called obesity. Now there's 37.9% of Americans are overweight or obese, suffering from obesity. And we actually have 70.7% that are actually suffering from overweight and obesity. And we're struggling, and because of so many different factors, and we're going to talk about some of those tonight or today to be able to share with you some of the reasons of why what we're doing is working, because it's more than just the idea of eat right and exercise. And some of you have seen the MODAC study and some of the statistics that show the obesity growth rate. In 1985, many of the states didn't even report data. There was very minimal data that was being collected around the idea of the states that were struggling with an obese epidemic. But what was happening was that it was just getting worse. And the CDC has actually provided some great information to show some of these statistics and to show how this is progressively getting worse. And this is in 2001. You can see some of the statistics down below where it shows that the light blue Colorado had less than 10% of its residents were obese. But the number continues to get worse and worse and worse. The numbers are statistically actually so bad that they've actually had to change the color diagram because more and more states are actually falling into 35% of their population is now obese. And this is a trend that's not changing unless we decide to change. And what you're going to hear during this presentation is health professionals that are bucking traditional medicine, and they're moving into a non-traditional model of healthcare. They're moving healthcare into the third era. They're no longer reacting to disease. They're no longer reacting to just pain and problems. They're actually providing solutions and creating prevention. And many of you are already aware of some of the statistics, but just for a quick reminder, this increase in technology, our, healthcare organizations have so many different awesome technological advances. There's no better place to be sick than in the US of A. But in terms of getting healthy, we're struggling. We're now seeing that this is the first time in American history that the next generation will have a lower quality of life and a lower mortality age than the previous generation, which is unheard of considering this amazing technology and all this education that we now have with scientific research. We're now in a position where we're 37th overall in performance amongst 191 members of the World Health Organization. We're 72 in overall level of health, and we're last of quality of healthcare in 19 leading industrial countries. It's significantly challenging to think about, what it's costing us to be unhealthy. We're the first in cost, $2.9 trillion that goes towards healthcare. It's the highest per capita per year. It's growing at a 6 to 7% rate, which is unsustainable. 50% of the increase directly from technology cost alone. Obesity is a greater cost now than smoking has been, and many of you have seen the tragic consequences of those who have taken on the habit of smoking, and the significant challenge to get an individual to quit smoking. $1,800 greater cost for those people that are obese, and just $1,275 for smokers. And the challenges that smokers face from a health perspective. Now think about this idea for those who are morbidly obese. People that have a BMI score that is not favorable for them are now at a $5,000 increased cost compared to a person that's at a healthy weight. The treatment continuum continues, and this is not new information. Most of you are dealing with patients that have an increase in medications. They're now wearing their medications as a badge of honor. They have so many of them that they're proud to present the list, but they don't like the idea of the medications or the side effects or the symptoms that come along with it. But they don't think that there's a solution. They don't have the hope. And oftentimes they understand that they can't afford to get healthy. They think that it costs so much more. And the reality of it is we can't afford not to get healthy or to help our patients to get healthy. 95% of the $2.3 trillion annually that is spent is actually spent on treating disease. 75% is spent on treating just five conditions that are heavily influenced by lifestyle, including heart disease, diabetes, prostate cancer, breast cancer, and the obesity costs. And actually 85 to 90% of type 2 diabetes symptoms and heart disease can actually be prevented by changing lifestyle. Why haven't we made the shift? Well, the reality of it is it's a tough shift. It's a tough shift when the machine is moving at a pace that is hard to turn around. It's like a huge cruise liner. Trying to change a cruise liner's positioning is significantly challenging. And that's why individual health professionals are actually choosing to change. Dr. Wayne Scott Andersen, the co-founder and medical director of our organization, OPTAvia, actually was one of the 10th physicians. He actually was the 10th physician board certified in critical care. He's the valedictorian of his medical class, and he actually trained in some of the best teaching hospitals in the country. He actually was he was the department chair of the Department of Anesthesiology in Dayton, Ohio at Grandview Hospital. And he was doing amazing work. He was saving people on the operating table to be able to help them to survive the major challenges that they were facing from their unhealthy lifestyle choices. But Dr. Andersen first took the Hippocratic Oath and said, first do no harm, and I'm not doing people what they need to have done to get the results that they desire. And I want to change that. So he began this process of pioneering a concept called health and lifestyle coaching. Over 17 years ago, Dr. Andersen created a partnership with a major organization by the name of Medifast, a publicly traded company that had lots of scientific research and had a great model for giving individuals a structured model to decrease their weight, but who didn't have a really good lifestyle program. And Dr. Andersen said that he believed that he could actually provide structure, he could provide education, he could provide support to give people a new strategy for creating health and well-being in their life. And over the last 17 years, he has been refining that process with the partnership and the parent company Medifast to create one of the most trustworthy companies in the country, according to Forbes magazine in 2016 and 2017. With the financial stability of Medifast and with Dr. Andersen's passion, he began to create a new path that was not just a diet, wasn't a detox. It was actually helping individuals to create a new path to create optimal health and well-being. He knew that if he could help create structure and if he could help provide a simple plan to move people to start making healthier choices and start adopting healthy habits, one healthy habit at a time, he knew that he could significantly change the trajectory of an individual person's health journey. And that's exactly what he's done. Over the last 17 years, he's impacted over 1.5 million people's lives with this amazing program called OPTAvia. And what he's done is not overly complicated. What he did is he created a model of care, that is something that is scientifically proven and medically credible, something that is actually based on science, not based on theory. And it's actually something that's teaching people to make better choices. Most of our patients are in a situation where they just have a broken picker. They're picking the wrong things. They're choosing the wrong unhealthy lifestyle choices. And if they were given a comprehensive system, we could change that. And that's exactly what Dr. Andersen has created with the 4 components of our system. And we're going to go through these 4 components, and I'm going to get a chance to introduce you to people that are in the healthcare profession that are actually utilizing these 4 components, and they're seeing some amazing things. I want to introduce you now to Dr. Sharon Fleischer. I've had a chance to partner with Dr. Fleischer over the last few years and seen amazing things that have happened in her individual life as well as the life of her patients and her peers. And I can't wait for each and every one of you to get a chance to hear her story. Dr. Fleischer, welcome to the webinar.
Thank you, David. It's such an honor to be here with you all. And I almost cannot believe to this day the joy that I have in my life, because 6 years ago, I was a typical middle-aged woman struggling with sleep, using sleeping pills on a daily basis, being very unhappy with my job, even though I loved what I did. I've been doing family practice for 20 years. It's all I've ever wanted to do. And I started not enjoying it. And that took a toll on me personally. It affected my relationships with my family. And it led me to a point at which I was thinking about leaving the only career I had ever had. But then something quite magical happened, and at the same time a little sad, because one of my patients had come into the office, and in a matter of 9 months, he had lost 140 pounds, and I didn't help him. No matter what I gave him, no matter what resources I told him to use, no matter what I wrote down each and every time I had a visit with him, he did this without me. But it was also the spark. It was the moment that I realized whatever he did, maybe if I introduced my patients to that, they would actually get healthier, and therefore I would actually become happier and maybe sleep better. And how did that all happen? He partnered with David. And David asked me, well, how are you, Sharon? How is your health? And the more we got to talking, he said, why don't you experience this program? Why don't you let us coach you? Bring some friends and patients along if you'd like. And then we can share it more with people in your practice. The results are astonishing. Not only did I lose 25 pounds, which as a middle-aged woman, I would take that, but I sleep like a baby. I have energy, passion, desire, hope. I just want this to be known to everybody because it has changed my life 180 degrees. I ended up helping a handful of patients, and that slowly grew. I helped family members and friends, and it just kept everybody kept referring to me because I was the one who spent time in the office actually helping people get healthier. I have taken people off of their diabetic medications, including insulin. And if they were my patients, I did it within 24 hours. Recently in a new practice that because of OPTAvia, I decided to change my location of my work, go part-time. I'm able to make a separate income in order to spend more time with my children. My children are healthier. But just this past Monday, one of my patients came in, and even though he's not a client, I coached him. I became a better doctor because I became a health coach. And I coached him 6 weeks ago, and I gave him little tiny things to do 1 week at a time And it was only 2 or 3 things that I knew he could handle. And he came back. After 5 weeks, he's down 16 pounds. His sugar is normal. I was the sort of hero doctor, but it wasn't anything that a doctor experience or a medical school training gave me. It was the OPTAvia coach in me that allowed me to recognize what it was that he needed to meet him where he was at and to hear what his concerns were. And then I gave him the stepping stones. And so my personal health improved, my joy of helping people improved. But what's amazing to me is the fact that I still get coached regularly by David. Each and every day, if I need something, he's there for me. And as practitioners, we tend to be, I know it all. I know exactly what I need to do. But we don't, or we do, but we have so many other life struggles that we can't get it done. And David's kind of keeping me grounded and keeping me focused more on my future and really creating the best version of me, my practice, my family's life, and ultimately being one of those leaders in the third era of medicine. And for that, David, I could not be more grateful.
I love hearing your story, Sharon, because it's really a matter of true transparency of somebody who is willing to admit that life wasn't grand as a physician and her health was struggling. And with the help of a recovering fat guy who was learning how to live a healthy lifestyle, I was able to coach her through the process of her own personal journey to get healthier. And that's what our OPTAvia coaches do. OPTAvia coaches are not nutritionists, they're not dietitians, they're not personal trainers. They're individuals that have gone through a training process that is actually built on our science, Dr. A's Habits of Health system. And given the tools that they need to provide one-on-one support and healthy guidance and encouragement and support to help individuals to overcome the barriers. But you see, our coaches are not there to teach clients the habits of health. They're there to guide them, to adopt them. And Dr. Andersen's Habits of Health system is an amazing system. It's a book. It's a life book. It's a system that gives them the steps that they need to take to learn how to create health in their life, not to just get rid of a problem or pain, medication, but actually learning how to create the outcome that they desire. And by making small, consistent changes with the help of a support system like a coach and with a resource system like the Habits of Health, individuals are able to create one healthy habit at a time to produce lifelong transformation. Our next panelist is Scott Carnahan, who Scott and I have had a chance to work together for a very long time. And Scott's been able to incorporate this program into his clinic, into his community, and also seeing it expand beyond the clinic doors and into new communities and new states. And I can't wait for you to hear his story. Scott, welcome to the webinar.
Thank you, David, and thank you for inviting me to be a part of this group, not only yourself, but this group of established healthcare professionals who are going outside the box. 10 years ago, I was introduced to Take Shape for Life, and my nature is I'm skeptical. And so I was skeptical of a program. I was skeptical of a diet. I was skeptical of portion controlled meal replacements, and I was skeptical of the price. I didn't, everything that there could be to have an objection against, I pretty much had it. And so I was softened up by listening to what the program was all about. And when I heard the science behind it, when I heard why it was developed, when I heard how it had worked and how it had been researched, it hit my core, and it said, this is everything I truly studied and what I believe. And so I'm like, let's give it a shot. And so at that time, we did a 28-day challenge. My health wasn't where I wanted it to be. So I did the 28 days and lost between 25 and 30 pounds. And I'm like, I started to become a believer. And I thought, well, if this can help me in my own personal transformation in my health, I was looking at 10 years ago, the obesity and overweight issue wasn't near what it is today, but I was seeing it develop. And I'm like, there were clients that we couldn't help physically in physical therapy because they couldn't move well enough to exercise. They were limited by their body size. And I'm like, this could be another avenue to help the clients that we want to help. And so started coaching at that point in time, and then hit a bump in the road with my clinic. I had a change in personnel, and as a private practice owner, I just had to cut some ties with something. And although I hated to do it because I truly believed in the program, I had to step aside from coaching. Well, fortunately, one of my friends that I'd gotten in the business of coaching, he said, you've got to get back in. This program, this company is just continuing to improve and get better. And while I knew that in my heart, it took me a little while. I finally said, yes, I got to get back in. About 3.5 years ago, I re-entered into the coaching program, and I couldn't be happier that I did. Just last year, I was able to, with a small side business, cover the salary and benefits for one of my employees through this program. And I couldn't have done that in any other program in this kind of thing. So from a community standpoint of how this works, I love the fact that with clients, we support them with phone calls on a regular basis. I'm truly surprised at the Facebook group support page that we have. I've never believed that a Facebook support page could have that much impact. But time and time again, when I'm talking to my clients, they're like, oh, I just love that Facebook page, that community support. You know, at 11 o'clock at night, they don't want to call me, but they'll go on the page and they'll find that support that they need. They'll find that encouragement. They'll see other people struggling and you know, find the encouragement they need to keep on the program, knowing that other people have gotten similar results. And the Habit of Health calls and the nutrition support team that we have behind us, just there's quality all the way through with everything we do. From a coaching standpoint, the fact that we do team coaching has made my life much easier as a healthcare professional. I have my own staff and we support one another treating patients with physical therapy. But when it comes to health coaching, I have a similar type staff with David and my other mentors to be able to help people in situations that maybe I don't have the experience of. So that support is invaluable and helps me be more efficient with my time. The thing that I truly love about this business as a coach is that while I'm in business for myself, I'm not in business by myself. And that's this team that you see. It truly is a team concept in how we approach this whole coaching business. Then when it comes to the science and the fueling of what these fuelings do for us, they're tools beyond compare. You know, when I first started it and it was Take Shape for Life, they were tremendous products then, but when the transformation to OPTAvia occurred, they took out the artificial flavors, they took out the artificial colors, no GMOs and no MSGs, and they added probiotics. And so from a label standpoint, you couldn't ask for cleaner tools to help somebody achieve their optimal weight. And there's no need to supplement with additional things because the nutrition is all there. So it keeps the program simple, it keeps the program neat and clean. And there's some hidden gems that I really love about this program. And one is, there's a lot of programs out there that people can do to lose weight, but they're complicated. And there maybe involves a lot of meal prep. Well, when you're on the 5-in-1 program, you're preparing one meal per day. And that's doable for somebody who's trying to make changes in so many areas of their lives. Prepping for several meals a day just doesn't happen in our society. And so I love that fact. And I after people have been on it a little bit, I say, you realize what you're doing is you are creating new habits in yourself because you're understanding what proper meals or portion size is. You're starting to understand what a healthy meal looks like, whether you're eating at home or whether you're eating out, so you can make better choices on a day-to-day basis. And those habits are what are the key to this program being not just a diet, but a lifelong transformation that we talk about. And the beauty of it too is that it's not a one package fits everybody. We can apply these tools, whether somebody needs to lose a lot of weight with our 5-in-1 program, whether somebody's exercising intently with a more of a modified 4-in-2 type program, or maybe they just want to clean up their diet and eat healthier, and they don't have a lot of weight to lose. Then we can look at more of a 3-in-3 type program. But just that flexibility to help not just people that are needing to lose weight, but anybody across the spectrum is the beauty of it as well. And when it comes to just as a business in its entirety, I love the fact that it's reproducible. And it doesn't take, it's rocket science, it's turnkey in that you can start it easily, you can reproduce it, and the business can grow without having to do it all on your own. It's there, it's ready, you've got support, and it's truly been a blessing in my practice.
That's great. And, everybody has their own path, and Scott's path was more of a jagged line to get to where he's at today. But, with his partnership in the early days, he's seen the growth and development and how we've been able to incorporate, virtual community and support calls and expand our product line to be a cleaner label option than what it was previously. Scott covered a lot of the things that we are offering in our community, but our community is a virtual 24-hour-a-day, 7-day-a-week resource. So rather than actually making it to be something where we're forcing people to come into a clinic model, we're actually putting people into a place where they're in control. They get a chance to use the resources and to communicate with other individuals who are seeing progress. And the model of team coaching is actually providing community to the health professionals, so they don't have to know everything. They've got resources and people that they can go to collaborate and to get information from. Our fueling models is our revenue driver, and so we just basically take the food money away from some of the fast food and unhealthy food environments, and we redirect that food environment to a healthier option. We have lots of different meal plans, but all of our meal plans are centered around the concept of eating smaller, balanced meals or fuelings all throughout the day. Every 2 to 3 hours, we're providing individuals with a healthy choice that they can make. And we're showing them how drinking more water will help them to satiate their body and to provide good hydration habits. And we're using nutrient-dense, carbohydrate-controlled meal plans to create a healthy fat-burning state, a mild state of ketosis, which accelerates fat loss. And because we're able to control the nutritional choices with those who are doing our 5-in-1 plan, we're actually able to create very predictable transformation. We're able to provide them with predictable weight loss, so they don't have to guess. They don't have to count calories, carbs, or portion sizes. We put them into an environment where they can actually get to a healthy weight quickly, but without having to learn all the things that need to be learned to become a healthier person. And whether the person is somebody that has a lot of education around health habits, or whether it's a person that needs a lot of education, all of the people that come to us can benefit, because the meal plans are customizable and they can be used in a very simple format, so that it doesn't take a lot of meal planning and prep, as Scott mentioned, to create that healthy lifestyle choice. We do have clinical studies that go back almost 30 years that have been proving our medical efficacy. This is the most recent clinical study, and you can reach out to the person that invited you to this webinar to get a copy of it, or you can go to the link that is shown down here in the bottom of the screen. But this most recent clinical study was actually comparing what it would be like if a person was to plan, prepare, purchase, and portion size all of their own food and just live an active lifestyle, in comparison to somebody that followed what we call our optimal 5-in-1 plan. Our optimal weight 5-in-1 plan includes 5 of our OPTAvia fuelings, which there's over 60 different options they can choose from, lots of different texts and tastes and flavors. And we provide them in a very simple format, delivered directly to their door, and they would eat those 5 fuelings every day, and then they would have one of their own meals that would be called a lean and green meal each day, that would be balanced with protein and healthy, low glycemic vegetables, and would have a healthy fat serving. And when they did this study, they compared those control group members to those individuals that used the OPTAvia program, and we had 10 times more weight loss than the control group. And this is not something that's new information for us, but it is showing those that are looking for the science, that are looking for the peer-reviewed research, that we have a proven model for improved health and lowering the obesity factor in America. And because we're more than just a food provider, we're not just a diet or a detox, we're actually providing coaching, we're providing them with support. And we're basically encircling clients to create an ideal support system, what we call the microenvironment of health. We're bringing in a coach, a social community, healthy fuelings, a virtual clinic, access to nutritionists and dietitians, online support, the Habits of Health system, which is the educational program, the Life Book, which is the journal, where we're basically helping our clients or patients to write a new story. And then healthy peers, connecting them to healthy friends and giving them an app that's simple to use, that they can use to remind themselves of healthy habits and healthy choices. And what we're doing is we're helping those individuals to not only create health and well-being in their physical and their mental life, but we're also offering them the opportunity, should they choose, to actually create optimal healthy finances. By becoming an OPTAvia coach and getting the training that is necessary to become a successful OPTAvia coach, individuals can actually graduate from being a client to becoming a coach. And with 1 million physicians and 4 million nurses in the US, we're not going to be able to help 320 million Americans to get healthy with the current model of care. Health coaches can become the intermediary between the individual population of America and the health professionals. And because those individuals oftentimes have more time than the busy healthcare system providers, we're able to provide them with a structure to support those individual clients on the program while being compensated for their efforts. So it's a revenue producing opportunity for those people who would like to do the work of coaching. And we've got so many great stories of individuals who have created this health and well-being model of the trilogy: physical, mental, and financial. And none better than Leah Gabriel, who's a nurse practitioner in Iowa. And I can't wait for you to hear more about Leah's story. Leah, welcome to the webinar.
Hey, David, thanks so much for having me. I just feel so honored to be a part of today. As David said, I'm a nurse practitioner here in Iowa, and you know, my story is a little bit different than the other two that have shared, but that's what makes this so fun. I found myself a little over a year ago really needing to find help. As a nurse practitioner, I kind of prided myself in being a picture of health, and what I was realizing after becoming a mother to 2 young girls is I was not that picture of health. And so I had looked at all kinds of different models, and I had tried all kinds of different things. And so when I came across OPTAvia as a potential solution to my weight issue, I of course tried to find all kinds of faults with it and all kinds of holes. And lucky for me, I had a lot of great people just like David who were able to just keep validating this amazing program and the rich culture and success that it had. And so after lots of looking at things, I decided to step into the program myself. Within 2 weeks of stepping into the program, I would argue I had seen a bigger improvement in my health because it didn't just focus on the weight, it focused on that mental aspect that David talked about. And I had a husband who had skeptically agreed to let me walk alongside me, that said, I don't know what you're doing, but I want to do it too. And we started walking this road together and finding health. And my story ended up ending that I had 65 pounds that I'd lost, but I recognized that what I had changed was what everybody else that I was working with as a practitioner needed. I was sitting in offices watching people desperate for what I was desperate for. And that was, what was it that they could do to help move their health forward? So I really saw it as an opportunity to jump on as a coach, not only to help me keep accountable to the health changes that I'd made, but also to provide it to people who so desperately needed the exact thing that I desperately needed. And so you know, it's been a year now, and it's been a wild ride, and it's been amazing. I'm seeing patients, just as Sharon had mentioned, Scott had mentioned, whose health has just drastically changed because they've got this tool in OPTAvia that makes it easy for them to be supported and learn habits and improve their life. And so I get excited messages each day. And it's really renewed the passion in me on why I went into healthcare, and that was to help people move their health forward. And it's been fun being on this preventative side of health and seeing the excitement, and then getting to spread, you know, that gift to other people. And so I'm excited to see where this takes me. But what I can tell you is as a healthcare provider, I feel like I am at a beautiful spot for the first time in years, because I'm actually seeing people get well. And I'm excited to take this tool that is OPTAvia and continue to see other people get healthy. And so I just am completely thankful for David and am so encouraged by the future of what this system can offer you as health providers.
Thanks so much, Leah. And it's been fun to watch Leah's story because, oftentimes health professionals come in and they're somewhat reserved. They've heard it all. They've been told it all. Oftentimes they would even label themselves as professional know-it-alls, and they know all the ways to do it. And then they find OPTAvia, and it's not what they knew that was the issue. It was what they knew for certain that just wasn't so that was the issue, and they become awakened to this new model of health and care, and this model that is so complementary to the work that they do as health professionals. So, why do people become an OPTAvia coach? And maybe right now you're just saying, I'm more than overwhelmed with my current duties. And, it may or may not be a right fit for you, but what it does do is it does reinforce your decision personally to be healthier. So as a health professional, to not just be a professional teller and tell other people to eat right and exercise, but to actually lead by example and be in a situation where you are actually leading your patients to optimal health, and you're showing them the way, and everybody can get healthier. So the opportunity to pay it forward to make a difference is obvious. You're already making a difference as a provider, but the opportunity to help individuals to create the trilogy of optimal health is very fun. And it's very rewarding from a financial perspective, as well as just the currency of goodwill. Being able to give your patients and give your friends and family members and other providers the vehicle to help them to create the trilogy of optimal health in their life is very rewarding. You will see a shadow that casts the shadow beyond the grave, and you'll actually see your life actually continuing to see other people getting healthier in this current business model. And the way that the business model works is quite unique. People become OPTAvia coaches because of the reasons I just shared. But there's an opportunity to grow beyond helping just patients on the program. You can actually become a business coach, and you can actually grow a team of OPTAvia coaches, which is oftentimes what health professionals will begin to do because they believe in the model of what we're doing, and they can't help everybody. And so rather than just helping everybody or trying to help everybody, they begin to help other people, to use the system to help other people. And that oftentimes begins to provide organic growth, and they get compensated for providing business coaching services. And so by providing those services, they actually get compensated by OPTAvia, even though the coaches never pay the business coach. They just simply help people to use the OPTAvia system, and the OPTAvia organization pays the individual who is providing that leadership. And then there's an opportunity for business leadership. And business leadership is based on individuals who would like to grow teams of business coaches and OPTAvia coaches. With 320 million Americans, we've got a big job, with 71% of them being overweight and obese, and many of them struggling with lifestyle-related diseases. We need more feet on the street. We need more people who are willing to step into the game of health coaching and to lead teams of health coaches. And I can't wait for you to meet this next panelist. Dr. Amy Michelle Willcockson has been in the wellness world for a long time, and she's been leading the wellness revolution in lots of different capacities, including owning her own chiropractic clinic that was a large practice in Minnesota, as well as actually becoming the director of a statewide organization that was trying to create a massive change in a state that was experiencing some increasing trends in overweight and obesity and many unhealthy lifestyle issues. So I can't wait for you to meet Dr. Amy Michelle. Amy Michelle, welcome to the webinar.
Thank you, David. Can you hear me?
You bet. We can hear you.
You can see me. I've been having some technical difficulties.
You're okay. Go for it.
Okay, good. So just a little bit about me. Yes, I have been in Iowa for 5 years now. Spent the vast majority of my career in Minnesota. 8 to 10 years ago, I unfortunately, and no one would have guessed this, but found myself in a health crisis. And I was very unhealthy. I had gained 35 to 40 pounds. I was extremely stressed out. I was physically fried, emotionally exhausted. financially overwhelmed, really professionally burned out. Developed all kinds of digestive issues, never, slept at all. And everything that cascades from there. So I was very unhealthy. I ended up in a health crisis in a doctor's office thinking, how did this happen to me? I know everything. I'm lettered. I'm a very successful doctor of chiropractic. I have a very big, large lifetime family wellness practice. I teach faculty at the school. I lecture health and wellness all over the place. I'm lettered in this stuff. I am a know-it-all. I was a know-it-all, but I wasn't doing it all. My integrity was out the window. My stress was out the window, and I wasn't living it. And information does not equal implementation, as I know for myself to be true. So like most people, we have plenty of information, right? But not enough implementation. So I had to get real serious about my health. I decided to actually put my priorities upside down, sell my practice, and move back to Iowa. It took me 4 or 5 years and hiring several different health coaches and a lot of money and a lot of time to restore my health and consequently my life. And long story short, I've created a radiant, vibrant, full life with all of the areas of wellness represented now, instead of just work first, which I know many health professionals really grapple with. And got my life and my health at the top of my own priority list. So again, it took me a long time and a lot of money, but I actually accomplished a great life with my husband and I really along the way on the journey. So in the meantime, coming back and recovering from my health, my poor health, I decided I didn't want to open a practice again. I didn't want a brick and mortar practice and employees and all that entails. And I wanted to help more people in a bigger way, but I didn't know exactly how to do it. I ended up becoming director of Live Healthy Iowa, traveled all around Iowa talking and teaching and preaching lifestyle and lifelong lifestyle transformation. And I became more and more passionate about teaching people lifestyle transformation, because I knew in my practice, in my clinical practice, I could only help people so much. I could adjust them all day long. I could help them with their pain, and I could give them, diet tips and how to eat. And I did workshops relentlessly, but really having the time to sit down and talk with people and to help them one-on-one change their lifestyles was literally non-existent. And so I became really passionate about it, because I had to change my own lifestyle. I really wanted to do that, work with more people on a one-to-one basis, but how could I do that in a way that was affordable and effective, affordable for them, affordable for me, effective. And I thought for a long time about creating my own system and writing a book and, developing my website and all of that. And I really found myself not wanting to invest that much time and energy and heart into that. And even though I knew that's what I needed, was a vehicle to help more people. I had a private consulting practice that I had clients in, but it was way too much for the average Joe to afford. So I happened upon a colleague of mine who had been using the Habits of Health system by Dr. Andersen, and I looked into it, I researched it, I thought, this is the best thing since sliced bread. I can't believe it. This is the vehicle that I need for my next phase in my career to, professionally speaking, it had the flexibility and the mobility, the ability to generate revenue, of course, but also, and more importantly, it actually fulfilled my passion, because it was about lifetime lifestyle transformation. And I could help. It had everything that all of my clients needed, mentally, emotionally, spiritually, physically, and otherwise, to learn to do what I had done at a fraction of the cost and a fraction of the time. And so it was really perfect for them, and it was perfect for me. And I have been working, I decided to partner up and use the system since the beginning of the year. And I have been blown away at the results with my new clients and even my older clients, at the results, the effectiveness, The weight loss is really works, and it is scientific, like you say. It just works. It's been around for a long time, but it's far beyond that. What I'm really seeing with my clients is that the coaching piece is critical. To help them on a weekly basis stay on track and on focus. The focus on the mental emotional aspect. Everyone in our country is an emotional eater, practically stress is out the roof. So the focus on the mental emotional component of weight and obesity and that whole barrier is really the solution for everyone, quite frankly. That and the fact that we're all physiologically addicted to sugar. I've seen people break sugar habits. I'm a recovering sugar addict, and so I know what this is like, but I have seen people in just a month or even 6 weeks kick a sugar addiction that they've had for decades. And I've helped to teach them to live it, not to diet. And that is what I love about this system. It's a live it, not a diet. So I have a medical doctor up north who we started a program with. Her name is Dr. Renee Diamond. And she is doing phenomenal. She integrated this into her practice with the help of myself. I'm coaching her patients. We have 18, probably 20, 25 of her actual patients, staff and family that we're working with just phenomenal results and lifestyle changes that are going to be lasting. And she's integrating it into her practice. All kinds of doctors and medical doctors that I run into are looking for a way to help people. And more importantly, in our fee for service and the change we have here coming down the pike from a fee for service reimbursement model to a values and outcomes reimbursement model, it is even more essential that everyone take a look at this and get on board, because it is absolutely critical with this change in reimbursement happening in the country as well. So I think it could literally help us save our whole healthcare system and all of our families and suffering friends. So it's been phenomenal for me and professionally, and for my clients personally. So very rewarding. I'm thrilled to be a part of the team. I'll stop now, David.
Well, I love hearing stories like Dr. Amy Michelle, because that's really the efficacy of this program is that people that have been very successful in practice are recognizing the science, recognizing the results, and recognizing the opportunity to leverage this within inside of their practice or outside their practice, or both, to create the change that they desire. So it is a relational model. It's focused on creating optimal well-being. It's not based upon sales and product pushes. Individuals that become OPTAvia coaches are independent, self-employed. The work is very flexible. You can do it part-time or full-time. It's just not optional. You can't spend no time on it. But it's very flexible in terms of how you participate with it. So by partnering up with a coach, you could actually have a complementary relationship where maybe you're just referring patients to a coach. It doesn't have to be the healthcare professional that's actually doing the coaching. There's a low startup cost of $199 to become an independent coach with OPTAvia, and the operating costs are very minimal, and there's no inventory, so you don't have to be stocking products inside of your clinic or home to become a successful OPTAvia coach. You can work from anywhere as long as you have a cell phone and an internet connection. You can be in business, and you're in business for yourself. You're just not in business by yourself. So you don't have the pressure of somebody that's trying to push you to do something, but you do have the support of somebody who can provide you with answers. There's no quotas or monthly purchases required, and there's a complete training and online support system for coaches. So you don't have to be concerned about going back to school to become certified. This is actually a program that is all web-based, and it's all done in a mentorship model. So you work with a mentor to show you and to teach you how to become a successful coach, and that allows you to learn while you're earning. And so you get the opportunity to produce an income immediately versus going back to school to get credentialed, then to be able to find an opportunity to earn an income and having to build out a lot of office space. This doesn't require any of that. And you can work at your own pace. So whether you want to help one patient or 2 patients or 100, it's up to you. And there's really 3 options in how we work with individuals. We call it the good, better, best model. And the three options of how you can work with OPTAvia is that you could use OPTAvia as a trusted third-party provider and refer your patients to a certified coach and not be connected at all with the organization, other than just understanding that it's a medically credible way to help somebody and that it produces results. You can also do it as a health professional. You could become a health professional for $199, and you can actually partner with one of our certified coaches to do the coaching. You could still be referring people, but you could benefit from the financial opportunity that comes with referring people. And the third option is the best option, and that's the opportunity to join as a health professional in OPTAvia and to actually coach your patients with inside your practice or to coach other providers. So whichever option works best for you, we would love to explore it further with you. We hope that you've enjoyed this presentation. If you would like to get more information about some of the upcoming events, we are going to be hosting another webinar very shortly that's going to be titled Steps to Implement OPTAvia in a Practice or an Organization. We have both health practices and organizations, corporations that are using our health programming. And we're going to share some different testimonials of successful coaches that have implemented this into a practice and into an organization. We also have some personal jumpstart training opportunities that are coming up very soon. And we have local and national training events. We have our upcoming annual convention that's happening in July. And so be sure that you reach out to the person that invited you to get some more information if you're interested in exploring joining our mission. And we'd love to have you be a part of this growing group of individuals who are helping individuals to climb the mountain of optimal health, one healthy habit at a time, to create lifelong transformation. On behalf of all the panelists, I just want to say thank you for joining us tonight, and we look forward to hearing from you, each and every one of you, on what your next step is in creating a healthier life. Thanks, everyone.